DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. We're going to have a great show. We have Dr. Scott Fritz, Dr. Steve Ensley. They're from Kansas State University's Veterinary Diagnostic Lab in the Toxicology section, and we're going to talk toxicology, springtime, summertime, and cattle. Stay tuned.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey folks, welcome to DocTalk. We have Dr. Scott Fritz, Dr. Steve Ensley. They're toxicologists here at Kansas State University where we're shooting the show. And just thanks for being here on the show. If you think you have something going on toxicology-wise, pharmacology-wise, these are two of the best that I know. And working with them, I've worked on a lot of cases with them and will continue to do so. But thanks for being here.
You bet. No, thanks for having us. It's always fun to talk about toxicology.
It is, like I say, it's always exciting as long as it isn't your animals.
Right, yeah.
It's even more exciting then.
Well, yeah. So, yeah, toxicology is not the biggest part of veterinary medicine, but so, you know, we do a really good job of training everybody how to do bugs and drugs, and then the tox part, sometimes the best way you learn that is go out, have to be out in the field and get experience to be able to, you know, relate to what some of the things that we see are.
So let's roll into Dr. Steve and Dr. Scott. Let's roll into toxic plants and pastures and some of the things that y'all see.
Yeah, poisonous plants in general can be a real problem. You know, a lot of times you're trying to make that diagnosis after the fact. And, you know, some of the risk factors you think of, early turnout's one of them, because a lot of times those weeds will come out before the pasture grasses will. And so it's just, timing can sometimes be an issue. Early spring rains can sometimes kind of make that a little bit more of a problem. We see it at least in the springtime.
So I hadn't even thought about that the weeds will grow before the grass and the cows are hungry and we turn out the cows too soon, or do you just walk through the pasture and take a look, and do you have some sort of like gauge or?
Right, so yeah, the first thing you need to do, you know, when we try to teach veterinary students about poisonous plants is what they look like when they grow, you know, but that's the only way you learn that is being out in the pasture and looking at the plants as they grow, you know, what they look like early spring versus the middle of the summer versus in the fall. And so, you know, usually we say, you know, if you've got an extension agent or somebody in your area that's an expert at that, try to get with them, go on a pasture walk, or let them identify plants, you know, of concern in your area, because once you see those, you'll know, you know, you'll remember those and know. Every year is different. I know people have had pastures for 50 years and then all of a sudden one year we have a problem and they go, well, you know, the last 50 years we had no problem. What's the difference now? And every year, I mean, every growing season is different, so that's always a wild card. I mean, right now we're dry. You know, whenever we start to get rain, that's going to affect what weeds will grow and just how our grass production is.
I never thought about how management or just the timing of the turnout, just being a few weeks early with some different weather patterns, could make that a once in a 50-year ordeal.
Yeah, you see it time and again, and it's the same story that Steve was saying. You know, we've had this pasture for 50 years and kind of do the same thing every year, but the growing season's different. Now this year we turned out, you know, same date we have the last 10 years, but all of a sudden we got a problem. You know, just happens to be the year.
Or you put more cows out
Sure.
than normal, and you know, you try a little different, stretch that grass a little bit further, and it always seems to be comes back to bite us. Let's take a break, and let's come back and let's talk about some things that we're seeing, maybe some cases, some things that'll help some of these cattlemen and veterinarians. You're watching DocTalk. We got Scott Fritz, Steve Ensley, Toxicology, Veterinary Diagnostic Lab, Kansas State University. We'll be right back.
Welcome to Cattle Intel, brought to you by Neogen. Today we're going to cover a little bit about the main culprits of external parasites and flies that our cattle operations really battle every single year. First and foremost, our pasture parasites, horn flies. You'll see these flies up over the tops and the withers of our cattle while they're out grazing. The other being face flies. Face flies feed on some of the nasal secretions around the eyes. Now, those two key pasture components that we really need to plan ahead and understand that they lay their eggs, that they come in contact during the grazing season, that we need to plan accordingly to make sure that we are treating those animals while they're out grazing. This can be through insecticide impregnated ear tags. This can be through some feed-through products that we can put in mineral packs, or some of the dusters or oiler rubbers out in the pastures. Whatever that may be, work with your local veterinarian to be able to have that plan put together. The second two main fly culprits are for more confinement type operations, stable flies and house flies. This is where environmental cleanup is very important, as well as monitoring those animals that are being impacted. It only takes a few stable flies to really pack a punch and reduce some of their performance. Unfortunately, they're not long-term feeders, so we need to make sure that we are either providing something through the feed, having some environmental sprays and premise control, as well as even some of these wasp species that can be released to be able to control some of those parasites. A lot of different options that are available. Work with your local veterinarian to be able to come up with a plan for you.
Thanks for watching Cattle Intel by Neogen.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
So I weaned my first set of calves and I did the whole herd. Calves that I had processed, they were all laying down or they were at the bunk. The second time we weaned, did my steers with the Ferropeas, skipped the heifers. First day, the steers cleaned the bunk. The heifers, I bet they ate 25%. They didn't even eat enough to refill the bunk. The steers, they'd go to the water tank, they would drink, eating, and I'm like, this is really, really cool. No brainer.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with two friends and two colleagues, Dr. Scott Fritz, Dr. Steve Ensley. They're both here at Kansas State University. Talk to me about you've had some cases with Larkspur.
Yeah, so this year's dry again. We don't know what's going to happen, but last year we had a really wet early spring, and so we had weeds that grew that normally we don't see. Larkspur was one of those, and then Southwest Kansas, South Central Kansas, it was a big issue, and it was all, we started to get calls about it, and then tried to get the word out to have everybody look at that, but we had, substantial number of cases and dead animals from that as well.
Yeah, and as you walk through something like that, how do you go about diagnosing and getting a diagnosis from this kind of case?
Sure, they're a challenge diagnostically. In today's day and age, cell phones are invaluable. Everybody's got a camera in their pocket all the time and can always snap a picture if they notice something different from a normal year. And then we work with a couple different groups, and then we have an herbarium on campus that's invaluable with helping us ID some of these things if we're not familiar with them. And then there's a poison plant lab. USDA actually runs it. It's in Logan, Utah. And in their research lab, they're not necessarily a diagnostic lab, but they do a lot of poisonous plant research, and we'll communicate with them and work with them a lot. And they'll at least help us make a chemical diagnosis, so you can't really argue what they were exposed to at that point. And so they've been a valuable resource for us too.
So will you get, when you say a chemical, will you get a tissue samples in from the animal and be able to identify these chemicals or these toxins that they consume?
Yeah, it's tissue samples, usually rumen content's probably the best one, just, the plant's going to be in there. And you can actually look at rumen content under a microscope and sometimes identify some of these plants. So we do that at K-State Diagnostic Lab, but sometimes we don't have the actual chemical assays, and so we'll send it to an outside lab to do some of the chemical analysis for us on either tissues or rumen content and help us identify, the toxic compounds that we're looking for.
You bet. So when we see these cases, as we mentioned in the first segment, something different happens. We aren't normally seeing this. How bad does it have to be before you get someone involved or?
Well, yeah, normally, sometimes, retrospectively after they've lost 5 head, it becomes an emergency, and we go, well, it would have been, ideally, after the first animal dies, that's when we get involved, and that doesn't happen a lot of times. Everybody's, one animal dies, it's not too much of a problem. 2 animals die, they're getting a little more excited, and, when we have more than that, it turns into a real bad issue.
Dad used to say as a veterinarian that it was easier to sell a vaccine for a few $1,000s than to sell a diagnosis for a few dollars.
Right.
And we have experts sitting here that, when you have a cow die or, to have that veterinarian come out, take some samples and send it into the diagnostic lab and get the peace of mind.
Right, and so, yeah, poisonous plants, any of the animals that are a forage-based system, that's always an issue. And there's a lot of different things, nitrates this time of year with cows and calving is an issue, and, just basic things that we see. Or hauling water, if we have a dry year and they've got to start hauling water, we always have animals die from that. What they used to haul the water was the fertilizer tank they used to fertilize with, and they don't get it cleaned out and use that for their water source, and that's dramatic. When you do that, you kill a lot of animals pretty quickly.
Just goes back to, we've had shows on drought and different things that when we have to plan for when we're going to have these. Let's take a break. When we come back, more with Dr. Scott Fritz and Dr. Steve Ensley from Kansas State University. You're watching DocTalk.
Plant the seeds of financial security today with United Patriot Coins Precious Metal Starter Pack, the Patriot Pack. Exclusive offer for our DocTalk family. Call now and secure your financial future. Strengthen your roots with silver and gold. Call United Patriot Coin today and ask for the DocTalk special offer.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed Lidoband, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. Lidoband, a small device that can make a big difference.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Ranchers, looking to elevate your pasture management game? Turn to Heinen Brothers for expert aerial application. With state-of-the-art equipment and seasoned pilots, we deliver precision treatments right to your fields. From fertilizers to herbicides, Heinen Brothers has your pasture covered. Visit HeinenBrosAg.com to learn more.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson. I'm here with Dr. Scott Fritz and Dr. Steve Ensley. They're at Kansas State University Diagnostic Lab in the Toxicology section, and invaluable service. Just two of the experts that we have in bovine toxicology. And you know, when we were talking about different things, and we had Mark Sparrow on, we're talking about minerals and mineral supplementation. There's a lot of papers out there now about adding Rumensin for graze out, and you know, it helps limit mineral intake, it increases gains, but it can cause some problems too, can't it?
Yeah, so I mean, you know, I'm all for ionophores. I think they're great if they're used, you know, at the right dosage and, you know, at the appropriate manner, but there's the margin of error with those is not that great. And so we get involved in a lot of cases where an ionophore got fed, you know, too high, and all you have to do is make a one-day mistake and miss feeding, and that's going to follow you until those animals, you know, have died. So you can, you know, in a feedlot, I mean, you can feed them, do everything right, you know, for 200 days, but if you have one day where on a Friday where nobody was there and you've misfed those, that damage that you see there is going to be reflected in them, you know, until they're done, until they're closed out.
So, and I need to back up too, because that, you know, it is a great tool. It's a tremendous tool that's used in the industry. We're just talking about toxicology today, and so we're talking about some of the things. But Dr. Scott, what are some of the signs or clinical signs of a toxicity to a monensin or to an ionophore?
Yeah,
and I don't want to just single one out either.
Sure. Yeah, there's a lot of them. We use them in all different, you know, meat producing species, and we have issues. You know, I'm all for them too. I use them in practice all the time. They're an invaluable tool, and they add a lot of money, you know, at the end of the feeding period. But you know, it's a challenge clinically because they'll almost look like a respiratory disease. You know, generally they'll go off feed for a day. They'll have diarrhea after that, and then as you know, it targets the heart, and they basically go into congestive heart failure. So those animals might be isolated. They might be staying in, you know, neck stretched out, breathing hard. So a lot of times they get confused for respiratory disease and treated that way. Or, you know, to post-mortem, they can look like respiratory disease too, and they just get chalked up that way. And if you don't go in, you actually have to look at the heart under a microscope, and if you don't do that, you know, you can miss the diagnosis, and those can result in some massive death losses that we've seen.
So what do you see in hearts? What are the changes from Rumensin?
Yeah, so that, you know, it's different species that'll target either skeletal or heart muscle, and in the heart, it basically kills the heart muscle, and it'll replace it with a scar essentially that can eventually become mineral, and then that if it's a hard mineralized tissue, it won't function like it's supposed to. And so sometimes those animals that don't die right away, you know, if you know, in January they don't die, but by the time we get to June and they're 1,200 pounds and it gets hot, we can have some death losses associated with that later on in the feeding period too.
Yep.
And so we like to, you know, tell vets when we have an exposure like that to continue to fix hearts all the way through, you know, just to go back and look, and we can at least see if they've had, you know, if that's responsible at that point in time.
So you've had a case where they didn't mix it properly or didn't get it incorporated properly into the trace mineral on some grass cow.
Yeah, so that was, we had trouble last grass season on exactly that. They were putting that trace mineral and then top dressing the monensin on top of that. And when you can't control intakes, that's when we get into trouble.
We're going to take a break. When we come back, a little more toxicology here with the toxicology section at Kansas State University. Hey folks, for your firearm and ammo needs, for gun safes and much, much more, and to have it personalized, come visit us at United Patriot Supply outside of Seneca, Kansas. You can also visit us online at unitedpatriotsupply.com. Be sure to say that Dr. Dan and DocTalk sent you, and we'll see you down the road.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had an injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
One animal has this huge impact on your operation. BVDV is one of the most costly bovine diseases, with losses of $15 to $88 per head.
The virus will actually cross the placenta and get into the fetus. As it's developing, its immune system will recognize that virus as it's supposed to be here. And so then that's where our persistently infected animals come from. They're going to shed that virus their entire life, and then it's going to impact your operation.
It is important to work with your local veterinarian and partner with IDEXX for the best solution for your operation.
Dr. Dan Thomson here. We're at Kansas State University with Dr. Scott Fritz, Dr. Steve Ensley. They're at the Kansas State University Veterinary School and the Veterinary Diagnostic Lab in toxicology. And we're, y'all have a pretty cool project coming up.
Yeah, so we do what our focus is here at Kansas State. Really, it's food animal veterinary toxicology, and that's not there's not very many people in the U.S. anymore involved in that, that kind of a specialty niche, I would say. So. Yeah. But those are, that's what's most exciting to us, and we get to talk about cases all over the U.S. because most places don't have, the resources to be able to do that. So one of the things we were able to do, we got a grant, a USDA grant in the last 6 months that's going to help us with training and also a hotline. So we're going to have a call-in hotline just like the pet poison call-in hotlines you might know about, but it's for producers and veterinarians and to get questions answered about some of these issues that we see very commonly and may not be well known in the the veterinary world, I guess. So
yeah, and Scott, the reason besides being a small number of people that do this, there's other reasons why we need a hotline, right?
Yeah, and it's, after hours and holidays and that kind of thing, when all these problems, if it's not your usual crew feeding the day before a holiday, or, people want to get out early on Friday or whatever, and that's when the problems happen. And the hotline at least gives you a resource to handle before, get you through the weekend and have a positive impact before Monday rolls around. Because most of the diagnostic labs are open 8 to 5, and that's when you're going to get a hold of somebody.
Yeah, I just have had, it just seems like whether it's the 4th of July or Labor Day or Christmas, if you're going to see some weird thing happen or, we ship a hot carcass or something, you're just like, because we're not in our normal routine.
Right.
Yeah.
And so it gives us an outlet.
We always say never get feed delivered on Monday or Friday. we see a lot of issues from things that happened over on Saturday with a new crew or Monday or Friday, or especially before a big holiday. I mean, that's always dangerous. So.
Yeah. So when you start to think about things that we can do as producers working with you in toxicology, what are some things that would be helpful or beneficial?
So from our perspective, if we can get involved, the earlier we can get involved in a case, the better it is. Not always, after one animal dies, but if we get multiple animals, we'd like to get involved in the case as soon as we could, work with a veterinarian, and we'll get the appropriate samples and get samples that we can make a diagnosis with is the main thing. So they can be timely.
And so Scott, when obviously some of the things with toxicology are different with samples than others. What are some of those that you would like to see us do?
Yeah, some of the sample, like the specific sample types, are just different. Like as an example, in tox we use a lot of ocular fluid. We can use it to make diagnoses post-mortem, and if we don't have that sample in the box, then we're kind of limited on some of the things we can do. And it just goes back, I think, to work with your veterinarian, and they call us, we can talk to them and bounce potential problems off each other and get a robust submission with the samples we need, because the samples we need are different than what the pathologists need, which is different from what, the people who do the PCRs are going to need. And so it's just trying to get a well-rounded submission, because our job at the end of the day is just like yours, is trying to reach a diagnosis and identify a problem.
Solve the problem. Or to get like me, I just load the whole thing up and drive to D-Lab, drop it off, and let you all have it, and that way we don't miss something.
Yeah, it's good for the students too. They're always on the necropsy rotation. When you drop a full carcass off, they get to cut that apart and give them back to the next generation. That way they get some training, hands-on experience from that.
It's great. Thanks for being on the show, guys.
Thanks for having us.
We appreciate all that you do at K-State and all that you do for our veterinary profession. Thanks for watching the show. Remember, if you want to know what we do at DocTalk, you can find us on the web at www.doctalktv.com. Always work with your local veterinarian. With Dr. Scott Fritz and Dr. Steve Ensley here at Kansas State University, I'm Dr. Dan Thomson, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.